what Dr. Yela, I hope I have your name right, was just really helping us with is the idea of really tertiary prevention and some secondary prevention. Thank you. From a public health perspective. Is that too loud? You could probably crank that down a little. If you like a rock singer. Okay. Okay.
This one, I'll mute that one.
Otherwise, I might start doing karaoke, and that would be really.
Try that.
How's that? Is that better? Can everybody in the back hear? Okay.
Okay.
Thank you.
Here's the electron. Turn that one back on.
Okay, great. Thank you. So he was talking about somebody's already wounded, and they're already traumatized, and what you can do, and the kind of trauma that is really obvious. I mean, when you see that person's face, you can imagine the kind of what's going on for them, not just physically but psychologically as well. So it's very concrete. It's really easy to see, not so easy to prevent. But the programs that you guys have been involved in, that he talked about, are efforts to try to reduce, in terms of secondary prevention, reduce the further harm, not try to keep people from rotating through the ER and getting shot and stabbed again. I want to talk to you more, and I guess that's what Rob will be doing too later, is what do we need to know to do more primary prevention? What do we need to know to stop this stuff from happening? And what is it that's happening? And what is the groundwork for why, when he showed that statistic about how violent the United States is, why? I mean, why is it such a violent place compared to other civilized nations? Why does all this stuff happen? Well, I really had no answer for that until I understood the issue of trauma and adversity and chronic stress. And then it started to make sense. And why I think this topic is so important is it's like, you know, if you know anything about history, and I'm sure everybody here does, you know there was a time when if you got an infectious disease, nobody knew where it came from. Might have been a possession of a demon came and gave you a disease, or you hadn't properly done a ritual of somebody that had died, and therefore you got a disease. And the breakthrough for science was in recognizing that infectious disease comes from germs. Comes from bacteria, comes from viruses, and that changed our whole approach. And of course, that's why we've been able to eliminate, or at least curb, a lot of diseases that we couldn't do a couple hundred years ago. For me, trauma theory is analogous to that in terms of human behavior. What makes people tick? And what makes things go wrong? How does that happen? Why is there so much domestic violence? Why is there so much abuse of kids? Why is there so much interpersonal violence all around? Why does that happen? How does it happen? And that's what I want to talk to you about. Okay, and it really originates to understand the why, to really have a clear conceptual framework for how big this topic is. It really originates in our still burgeoning understanding of how delicate human development is and how important human attachments are. And the earlier and the younger the child, the more important, the more that determines what happens from that point on. A huge problem for the human species, and you know, not to scare anybody, but there's no assurity that our species is going to make it even past this decade, because all around us there are many, many opportunities for total annihilation. And we need to understand pretty rapidly, how could that be? How could a conscious species entertain the possibility of complete extinction? I mean, so it happens to other animals, but they, we assume, don't really know what they're doing. We do. And we seem to be headed in some pretty dead-end ways. So why? Where's that coming from? Well, my answer to why is because that's what we're prepared to deal with. That is a good picture of our evolutionary environment. We were surrounded by hungry animals who wanted to eat us. And there weren't that very many of us. And we were usually family. We lived in family groups and tribes. And we learned to hunt them so that they didn't eat all of us. And so we developed, as all mammals did, this amazing fight-flight response. It's an amazing response to threats to our survival that were very effective in helping us survive in that environment. That, however, is no longer the way we live. We do not live surrounded by hungry predators that want to eat us. We've pretty much vanquished every species on Earth. But our biology hasn't changed. We have the same stress responses. It's just that they're no longer about actual survival. It's more about things like this. These are the things that are stressing us. Constant people around, cell phones, email, stresses at work, more work than you can get done, traffic, people cutting in front of you, honking noises, deadlines, decreases in funding, too much paperwork, all that. But our biological responses to that change in environment hasn't changed one iota in thousands and thousands and thousands of years. So we really, biologically, are no longer really well equipped to live in the environments we've created. And that poses enormous problems for us that we have not yet committed ourselves to really changing. And part of that, for me, is I think people need to know what that means. I think we need a different conceptual framework for how to understand that so that we can begin to develop strategies to not be so subjected, not be so controlled by these biological evolutionary impulses that no longer serve us very well. So to understand that, we need to understand a lot about stress. There are different kinds of stress. Positive stress, that's the stuff that happens to you that always, you're getting stressed a little bit today because all learning creates an atmosphere in your body of low levels of stress, because that's what rivets your attention and makes you interested, and that's how your brain works. So it's what happens when you go to school for the first time. Your kid is stressed, but it's good stress, because it helps us grow. If the mind and the body don't have positive stresses, then we just stay stuck. If the body doesn't get stressed, your bones won't develop properly. So we need certain levels of stress. And then there's tolerable stress. Tolerable stress are bad things that happen, but we have, with enough social support and enough internal resources of our own, we handle those things. So somebody we're really close to dies, it's terrible, we grieve, and then we move on. It's the bottom two that we're going to focus on today. It's the toxic stress that is at the bottom of so much of our social dysfunction. Toxic stress that begins in childhood, that a child has no real control over, and that goes on and on and on, and doesn't have to come from the kinds of things the doc was showing us. It doesn't have to be that dramatic. It doesn't have to be that awful. It's basically more of chronic stress that a child can't handle in a developmental period where they don't have too many resources yet. And the word toxic is a really useful word to use because it's very much like toxic stuff in the environment, but that's really what a child is being exposed to, only it's emotional toxicity for the most part. And then there's traumatic stress, which you just saw pictures of all different kinds of things that overwhelm the person's capacity to cope. And what makes it such a big deal is because particularly toxic stress is what happens to the brain. Most of our brain development occurs after we're born. Our babies, human infants, aren't really able to do very much when they're born. Like if you look at a deer pop out or a horse, the horse runs off and starts nursing right away with mom. And our babies, they don't run around. They're going to be dependent for a really long time on their parents and their family. And what that means is the reason that is the way it is because we're not very well wired. Our brain is not well wired when we're born. So most of our brain development occurs after birth. We are born with twice as many neurons as we will ultimately have. And half of those neurons then get pruned away in early childhood. And what determines what gets pruned away is the environment. It's what's going on in the environment. So we've learned, there's a large body of knowledge, which I'll only touch on today, about the impact of toxic stress on kids. And what we're seeing is that in extreme cases, when kids are exposed to too much stress, their brains don't develop properly at all. They have smaller brain development. We do know for sure that kids exposed to toxic stress develop what's called a low threshold for stress. It means they overreact to very minor stresses as if they were survival threats. And I'll show you more about that later. Now, how many people jumped to the ceiling when that thing went off? It's a really good example because that chronic hyperarousal thing I was just talking about, somebody who is acutely traumatized or has PTSD, they will often literally jump off their seats and will be unable to pay any further attention than anything I'm talking about because it takes a while to calm back down again because you have it, and it's just biology. This isn't anything anybody can control. It's what happens to the central nervous system when you've experienced a traumatic event. And for kids who have been exposed to toxic stress, that's what happens to them. They often get misdiagnosed with ADHD, or they do have ADHD, but it's really tied to what has happened to them in the past. And they have a really hard time concentrating, as any of you would have if that kept going. If your bodily response to alarm, or we thought there was really a danger, you're not going to pay attention to me. I had an experience on 9/11. I was in Florida teaching, and I started to see people going to the back of the room on cell phones. I thought, gee, people are usually pretty interested when I just get started. I guess I better give them a break. And all right. So I gave them I said, looks like you guys need a break. And a person came up to the front of the room and told us what had happened. And I had just gotten done talking about chronic hyperarousal. And of course, you can't pay attention to anything else when that's going on. That's all your mind will enable you to do. So when that's happening chronically, it's really impairing kids' development in all kinds of ways. Their ability to be successful at school, to function with other people. Anyhow, we'll get more onto that. So cortisol. Cortisol is released as part of the stress response because if that saber-toothed tiger is chasing you and he wants to eat you, and you trip on a branch and you sprain your ankle and it starts to balloon up and it really hurts, well, the release of cortisol will decrease inflammation, and the release of other substances called endorphins, which are chemically related to morphine and heroin, will reduce the pain. So it makes sense in our evolutionary environment and when there's really danger, because those chemicals can really save our lives. Unfortunately, they're not that big a help when you're being pressured to do your medical records and you don't have time, or when some fool is behind you tailgating you on the car. None of that helps you very much. But people who have exposure to high levels of stress over and over and over again throughout their lives can develop some very abnormal reactions to those chemicals. And those abnormal reactions to those chemicals can lead to the things that ultimately we call symptoms, like substance abuse and self-mutilation and sexual addictions and all kinds of problems that really are, what is underneath that is chronic hyperarousal and trying to adapt to it. And we also know that chronic levels of cortisol exposure can damage the hippocampus. The hippocampus is the part of the brain that is very important in learning and memory. So if your hippocampus doesn't function right, particularly when you're a little kid, then you are not having the learning experiences and the memory experiences that other people are, because it's not working properly. And those cognitive defects can, if they're not altered in some way, can continue into adulthood. But it looks different for every person. So a definition of trauma. So I need to explain to you what I mean by trauma. I actually talk more now about stress and adversity and trauma because when you use the word trauma, people often associate it to those kinds of acute injuries or the things that happen at 9/11. And then they don't get that it's way bigger a topic. So Bessel van der Kolk came up with a definition that I think is really useful. He said, a trauma occurs when both internal and external resources are inadequate to cope with an external threat. That's what makes something a traumatic event. So it can't really be defined by an event itself. You really have to work with the person to see what was their reaction, what resources did they bring into the situation, and what resources were lacking for them. And let me just elaborate on that. Our bodies, down at the bottom of that circle, our bodies are our basic resource. We all are embodied creatures. We all come into the world, and as babies, that's pretty much all we have, is a bodily sense of self. And everybody's body is different. Everybody has different genes. Everybody has different family histories. Everybody has different reactions to different substances. But that is our primary first initial line of defense. And then out of the interaction in the environment, we develop a mind. We learn emotions and thoughts and meaning and how all that gets integrated together over time. And that becomes a really vital resource when you deal with the external world and things that are happening. How do you make sense of it? How regulated are your emotions? Can you handle any level of stress? And then there's this thing we call the spirit, which is a sense of higher meaning, larger connection, however a person defines that is beyond their mind. And all of that then comprises the self, an individual person. But in reality, no person exists separate from their social group. We are the most social animal ever. So nobody exists totally independently. That's a myth. It does not really exist. So every person is embedded within a family, and all families are embedded within a community, and they may have several communities. And all communities are embedded within this whole notion of humanity and society. And many of us would take that out even further to life, to the living system that encompasses all living things and the earth as a living thing. So that becomes then, you've got the individual self, and then all those other layers become our external resources. So if you look at that just visually, the individual person has all kinds of buffers against the slings and arrows of fate that happen as we go through life. Well, what happens if the family fails? How does the family fail? Well, the family fails when they're not there. Family fails when they are the source of trauma, the source of abuse, source of neglect or abandonment. When the family fails, particularly the child, it is overwhelmingly devastating. And the child then has to develop all kinds of protective defenses because they no longer are being buffered by their family, meaning their central nervous system is no longer being buffered. And many of the defenses that kids have to create in order to survive end up being hugely problematic for their success in the world. And often they cause a lot of problems for everybody else. And what happens if your community is also no longer available to you? And that happens in all sorts of ways. Most clear for us probably is what happened in Katrina, when even if people were survived, and even if their family survived, a whole community was wiped out. And you don't really know until it's not there how grounding being in community is. It's like, you know which grocery store to go to, you know your dry cleaner, you say hi to the guy that you buy a newspaper from. It grounds us and protects us, makes us feel safe in a way that you only really know when it's gone. And then and if you think about kids, think about child welfare comes in and takes a kid away from an abusive parent and puts them into a foster care situation. But in all likelihood, the child has lost his or her whole community. And then they may reestablish a sense of community, and then they get put in another placement, and another placement, and another placement. And every single time, that child has lost their whole community. That for a very abandoned and lonely child may give them a sense of safety that then is not replicated. And what if you lose the sense of being a part of humanity at all? You might say, well, how's that happen? Well, what's the first thing that has to happen for anybody to get any kind of behavioral health services? Insurance. And what's the first thing insurance companies ask you? Exactly. Their diagnosis. What's a diagnosis? Are mental health diagnoses like putting up somebody's x-ray and seeing they have pneumonia, taking a culture and finding that it's pneumococcal pneumonia? Is it like that? No, it isn't like that. It isn't anything like that. They are fancy descriptions of people's behavior. But they really do not, we don't know what causes that stuff. And people don't learn what causes it. But when you look at somebody's x-ray of their lung, the person doesn't become their sick lung. When you use a behavioral health diagnosis, it is a diagnosis of the whole person. It's a whole different level of meaning. And it starts the process of dehumanization. And the worst thing that you can do in any culture is to have groups of people who are dehumanized, because we live up to or down to expectations of our social group. And if you don't expect me to behave like a human being anymore, okay, I'll show you. I won't. And think about the whole criminal justice system. Think about all of the people in prison and their children who no longer are considered to be fully human. They will never get the rights. They can never pay enough. They'll never get their rights back, as many states have it constellated right now. And they are not really treated as human beings. There are many prisons around the United States We take these people who have done bad things to other people, and we put them into the most violent, frightening environments that is possible to even conceive of. And then they're going to come back into the culture, dehumanized and more dehumanized. And that's dehumanization of a human being is a slippery slope. It ends up in people capable of committing genocide. So that's what we mean by trauma. It's really a big issue. It's really not about a specific group of people. It's really about human nature and the way we treat each other. Whatever, if a person has lost their family, if they've lost their community, if they've lost their sense of being a full human being, then what you've got is a naked self. And that's what that picture is meant to convey. It's a naked person just completely vulnerable to the slings and arrows of fate. And it may occur in any way. It may affect any level of function. It may affect different functions simultaneously. And what Dr. And is going to tell you about in that semi-transparent arrow is how the things that happen in childhood may not manifest for decades later in diseases and social problems in adult life. But there's now this dimmed down self that isn't nearly the person that they were meant to be, and they get into some social service somewhere. If they end up in the adult system, they're likely to get those diagnoses. In the child system, they're likely to have those. If they end up in medical care, that's who will see them, but the physicians are not likely to make any connection between these diseases and their previous problems. And it's really where all the bad social problems, I believe, are coming from in our culture. Child abuse, domestic violence, community violence, criminality, and war. It's all coming from the same place. It's all coming from the way we treat children and what we do with them afterwards as they mature into adolescents and adults. So, underneath, if you want to create a self-destructive culture that will blow up the world, then you want to fill it with people who are in despair, who feel alienated, who have learned they get something out of being cruel, who do not believe in social justice, who become increasingly destructive and become enamored of death. So if you think that's just crazy liberal me, just watch television for about 24 hours. Just any channel pretty much. Not the public television probably. But any other regular commercial television and you'll see what I mean, what it's about. And just think about what children are carrying away. What are the messages that they're getting from our media? Then they come into service. They get a diagnosis, DSM. And these folks often get 2, 3, 4, 5, 6 different diagnoses. And the problem with that is that does not help us very much. If you are confused when you encounter a patient who's sent to you who is depressed and has a personality disorder and has physical symptoms and has bipolar disorder and is on 25 different psychotropic medications, you're not alone. Where do you start? How do you even understand how to relate to that person? Because the whole system has just made them something that I don't know. I don't know how to relate to that. Okay, so we need new metaphors. And I want you just to think about this as how deep this issue is. So this is a computer brain on your right, made up of microchips and a hard drive, and over on your left is the neurons going into the brain. So computer brains, now is anybody here that has never been on a computer? Okay, I didn't think so. Okay. So you don't have to have any more knowledge than this. Okay, so relax, because this is all the knowledge I have. Computers have hardware, operating systems, and what's called application software. And hardware in a computer, microchips, hard drive, monitor, mice and keyboards. And look at that one. Look at that one. What's in the bottom of all the hardware of a computer? It's a motherboard. But you remember that. That's really important. Now, in a human being, we have lots of hardware too. Our DNA, and the DNA makes proteins, and all that combines to make cells, and cells combine to emerge organs, and organs emerge and make our whole bodies, and it's all connected together and wired together. But it's all hardware. It's what we come into the world with. Then there are two kinds of software. In the computer, how many of you use Macs? Okay, there are some Mac people here. Okay. And the rest of you use PCs. All right, now, the difference between Macs and Windows is that they use different operating systems. So in its foundation software. And the things that you want to do in a computer, like a photography program or PowerPoint or a word processing program, are called application software, and it's on top of the operating system. So have you ever tried to put a piece of Mac software onto a PC or vice versa? Anybody ever tried to do that? Didn't work real well, did it? No, because it needs to be, the application software has to be compatible with the foundation system, with the operating system. Well, in this analogy or metaphor, because I can never keep the two straight, which is the difference, we have many applications. We talk, we move, we do all kinds of things with our emotions, we perform, we learn, we teach. We have a gazillion things that we do. We are the most complicated species. But what's our operating system? What is it underneath all of the things we do that allows those to happen? And if there's an incompatibility, those applications won't work right. That was my question to me. Had to be there. What is it? Well, an operating system is a master program that controls a computer's basic functions and allow everything else to run on it if they're compatible with that system. Oh, and there's one more. This operating system is not showing you to the fullest extent my beautiful slides. Behind this, there is a really ugly thing, and it's a virus. So has anybody here had a computer virus? Nasty, wasn't it? Really nasty. A computer virus, what is it? It's a small piece of software that piggybacks on real programs, and every time the program runs, the virus has a chance to spread and just wreak havoc with everything. It's hard to diagnose. You didn't know that was wrong at first. It's virulent, it spreads, it's contagious, it spreads through your email attachment, so other people, completely innocent people, can get the virus. At first, it looks like other problems. You don't know really what's wrong. It can shut down your entire system. It's unpredictable. And you need to remember, it is a form of violence. That is. I mean, when somebody makes a computer virus to infect another person's computer, they want to hurt you. They want your life to be miserable because you can't do your work because you've caught a virus. That's the point. Okay, so what's the operating system for our minds? We've got hardware, for sure. We've got application software that creates our mind, but what's the operating system? I believe it's love. That love is the operating system. It is the power of relationships that is absolutely critical for human survival. And in more sophisticated professional terms, that's called attachment. Attachment determines whether anything else works properly. And if you don't get the attachment you need beginning in childhood, you will not be able to actualize your potential. You will not ever become a fully human being. There are accounts from the 19th century of kids that were literally raised by wolves, And they could never completely perform human functions, even though they had raw intelligence. They could not learn language properly. They could not really engage in relationships properly. What I'm calling the human operating system, John Bowlby, the granddaddy of attachment, called the internal working model. And he said the internal working model occurs and develops in the relationship initially between mother and baby, and then widens out to include father and siblings and other family members. But what's being laid down is a blueprint that will determine the child's interactions for the rest of their life. It's not unchangeable, but it is a blueprint. So think about a house, a blueprint for a house, and the builder starts using the blueprint to build the house. And then you decide to come in and go, no, I want to move the kitchen over there instead. And it causes major disruption to do that. It's doable, it's possible, but it is not easy once building has started to change the blueprint that's already there. That's what's happening in the brain of an infant from at least the time they're born. And that internal working model predicts the way that parent is going to be with their children when they're grown up, when they have children. The reason is that at this stage in development, all of the learning that a child is having is for the most part nonverbal. It's in the body, so what they're feeling in the body, how they're interacting with other people. It's mommy smiling, it's what mommy frowns at, it's all, but there's no words yet, no explanatory systems at all. It's just this gut level feeling stuff that's going on. And that's why when somebody has a baby, they automatically do things with their baby. And as long as they've had good caregiving, those things will be good things. But if you have a baby and you haven't had good caretaking, that's the problem. So how many of you are child welfare workers? So child welfare people frequently go into situations where something terrible has happened between the mother and the child, that when you step aside and go, you have to go, how could this mother say she loves her baby? And yet, she does, in all likelihood, love her baby. It's just that the mechanism of internalization of what child rearing is originated in her childhood before she even had words. So her cognitive part of her brain can say, I do love my baby, and it was wrong for me to do that, and then she'll automatically go and do things again. Huge dilemma for child welfare. And then the internal working model is comprised of a lot of feelings and thoughts and how we integrate them together. And the internal working model determines what things we're going to pay attention to and what we're not, what we're going to remember and what we're not, and what behavior to employ in different situations. Remember, all determined in a pre-verbal child, before a child can think about any of this stuff. So that's my virus. So what about the virus, in this case, as applied to humans? I've come to believe that childhood adversity and other forms of trauma do to the human operating system what viruses do to our computer brains. Trauma disrupts attachment, and disrupted attachment wreaks havoc with everything else. And it looks different in every person because our development is so complex. And that's why it's been hard to see it, because it looks so different in different people. It's been hard to find what are the common denominators. And when you start looking, I ran an inpatient program for 21 years. In the last 12 years of that, we treated thousands of adults who had been abused as kids. And that was the common denominator. Everybody looked different. They have different symptoms, different problems. Some were hurting themselves, some were hurting others. But the common denominator was disrupted attachment. that they couldn't trust other people, they couldn't trust themselves, that really basic functions had gone terribly wrong because of what had happened in those early years, and then it was often perpetuated after that. And it's really, our problem is that our brains need to be so well integrated. So you got on the bottom there, the person and their brain, and attachment being necessary for these complex integrations that comprise healthy behavior. Our emotions, our cognition, our behavior, and our moral conscience have to be all integrated together. And that's a very sophisticated process that takes a long time and good conditions within which it can happen. So, and that's how then each person deals with the external world, is based on that level of integrated function. So if something goes wrong with attachment, then everything gets messed up, and unpredictably messed up. You don't know which part of the person is going to be most problematic. But what's going to be missing is integration, is full integration. We're designed to function in a fully integrated way. And I would just, as an aside, think about integration at the individual level, and also think about it at the organizational level, and think about it at the social level. And we don't have that. We don't have full integration of human capacity yet. Okay, so what's attachment trauma? What's the obvious things you know? When the attachment figure is the source of the trauma, that's bad, 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 bad. Because of the, again, you need your family to buffer. So if your family is the source of it, because you get physically abused or sexually abused, whether it's a family member doing it to you or failing to protect you, it's pretty much in the psyche the same thing. Neglect turns out to probably be the most worst thing. Because even if somebody's physically abusing you, at least they're connected to you. But in neglect, there's just an absence of. Kids witnessing domestic violence, abandonment, and community violence. Then there's disruptions in which an attachment figure is perceived as unavailable as a result of some unplanned but significant separation. And these occur when a parent is mentally ill, so when a mom has a postpartum depression, or when there is mental illness in the family and therefore the kids are not getting what they need. Happens in parents being, that we've created in this country a complete multi-generational nightmare because of the rate of incarceration. Most of these people are parents. And when you take a parent away from a kid, there are consequences to that child. And there's been very, very little attention paid to this disaster. And it's going to go on and on and on and on. So we have created whole generations, whole neighborhoods of kids who have disrupted attachment. And substance abuse. So when a parent is drinking or is on drugs, they may be physically present, but not able to really interact with the child's attachment needs. So the baby's left in the crib, the bottle may be propped up against, and that, although the baby might be fed, that is not sufficient. There's lots of studies began in World War II, looking at kids who lost their parents because of the war and were in orphanages. And they were well taken care of, basic needs. They were warm and they were fed, but there were too many babies and too few staff. And there were lots and lots of babies who just withered and died. Not for lack of food, but because attachment is vital to our survival. And then there are attachment injuries that occur when a child feels abandoned by the person he or she is attached to when there is a crisis. And these last couple, you may have a very hard time getting a history of, because they are things people don't think of. So mom and baby are in a bad car crash. and a mom is seriously injured, but the baby's fine. So mom's going to have to be in the hospital for a prolonged period of time, and the baby is taken care of by grandmom. And everybody thinks that's fine. And that may be fine if the baby's 3 months old, because at 3 months old, the baby hasn't developed a specific attachment to a specific person. If the same exact thing happens when the baby is 11 months old, that child may experience the results lifelong of disrupted attachment. Because by 11 months old, the child has developed a specific attachment to a specific person without the capacity yet to understand that mommies may be gone, but they'll come back. So you may never, because nobody thought anything was wrong, you may see a severely acting out kid and not be able to actually get the history of what went on because nobody even remembers it. And we've known for a long time that losing an attachment figure through death is bad prognostically. It predicts a lot of problems later in life. And then if you're in child welfare, you try to do something with the more severe cases. And if it's not working out with the family, you try to get the kid into another setting. And unfortunately, it often doesn't work, which is why we have these horrible situations where kids, have multiple placements and multiple disrupted attachments. Well, the thing is that you can stop hurting a kid, but that doesn't change their internal blueprint. So they carry into the next relationship the attachment style they've already created. And that can cause enormous problems in the foster home. So the foster parents who don't know anything often about this then toss the kid out. And the kid goes to the next foster home and the next and reenacts it over and over and over again. So this is the intergenerational mechanism of the transmission of trauma. That this goes on because it all begins in nonverbal experiences. It can go on unknown and unrecognized down through the generations in how to care for self and others, how to manage emotions, how to behave, what should be expected or anticipated, and what to remember and what to forget. So that what is considered normal may diverge radically from what is healthy because it's what my parents did. It's what my grandparents did. It's the way my great-grandparents did. And we can end up with extremely skewed social norms in terms of parenting and child rearing as a result. So Gordon Hodis is a child psychiatrist, done a lot of work in Pennsylvania, said many providers assume that abuse experiences are additional problems for the person rather than really what they are, which is the central problem. Trauma touches everybody's life. 50 to 90% of all adults and children are exposed to a psychologically traumatic event at some point in their lives. Interpersonal forms of trauma cause a lot more damage than naturally occurring disasters. Women suffer overall higher rates of PTSD, and that's really bad because women have babies. And so those effects of PTSD then will be manifest in those early attachment experiences. Children who are traumatized under 10 are 3 times more likely to develop PTSD when they become adults. So it sets the stage for vulnerability from that point on. And it doesn't matter where you look. You can look at the population of severely mentally ill, and what we see is that they have very high rates of exposure to child sexual abuse and physical abuse. Virtually all of them get victimized at some point in their life, often after the diagnosis. 80% of women with severe mental illness reported either physical or sexual assault in adulthood, and they get high rates of PTSD after a traumatic event. So, what we like to do is say, oh, well, the chronically mentally ill, they just have these brain things, and put them on meds, and that's about it. No, well, yeah, but what about that enormous interconnection between the biological impact of trauma and the mental disorders that they have? And how much worse does that make everything? Why is it that some people with a chronic mental illness can do really, really well, and other people are cycling in and out of hospitals all the time? Maybe it's not just their biology. Maybe it's that they're getting triggered because of the trauma all the time, and that's never been dealt with, and it's trickier to deal with because you got a couple problems interacting. The exposure of our kids, I got to see what my timing is here. When am I supposed to finish? 11. But we started late. This was a recent Justice Department report about the rate of exposure in this country of kids to violence. And more than 60% of the kids surveyed had been exposed to violence within the past year, directly or indirectly. Nearly half of the children and adolescents surveyed were assaulted at least once in the past year. More than 1 in 10 were injured as a result, enough injury to have to get medical treatment. Nearly a quarter were victim of a robbery, vandalism, or theft. 1/10 were victims of child maltreatment. 1 in 16 were victimized sexually. So just consider, these are children, consider the pool then of trauma going out from this. It is, it's staggering because as we don't have any kind of national health reform, and as managed care has diminished the capacity of people to get mental health services, most of these kids are not going to get any attention when they're kids. And if we look at urban exposure to violence, this is a study from Detroit, Chicago, LA, and New Orleans. It suggests that about a quarter of kids surveyed have witnessed somebody shot and or killed during their lifetime. Why? Why? Why is it that people can have as many guns as they want to do whatever they want, and that's the right, but nobody else has a right to guarantee that their kids are going to be safe? I don't get it. Children at a pediatric clinic in Boston, 1 out of every 10 children had witnessed a shooting or a stabbing before they were 6. And in my city, in Philadelphia, I don't think that'd be any different. It might even be worse. And the National Center for Juvenile Justice estimates that a quarter of violent juvenile victimizations take place on schools. So kids aren't even safe in school. Kids aren't safe anywhere. So, what does this do? And I can't go through all of, this is Trauma 101, that's all I have time for. But there are some key things I want you to understand. Number one is what I said earlier. The environment physically changes the brain. So the environment of early childhood and adolescence is changing the brain. It is determining how the brain is going to be wired, what parts of the brain are going to be connected to each other, what we're going to retain, and what we're going to prune away, because we come into the world with twice as many neurons as we'll ultimately have. So this notion that, we've been kind of fed this stuff for a long time. It's all about the genes. Not really. It turns out that nurture is at least as important, and there's a lot of evidence. Get a DVD called Ghost in the Genes, Nova, PBS Nova, about how trauma and everything I'm talking about is actually changing people's genetic structure, and that's getting passed on generation to generation. So I want to detail and show you an example of chronic hyperarousal, because that is the hallmark of all this exposure. Toxic stress, adversity, and trauma. It changes the central nervous system, and it makes people entertain experiences of chronic stress, and they become chronic hyperaroused. So it takes very little stress to get a major inappropriate response, because they're not really in a survival situation. Have any of you seen Antwone Fisher? It's a really good movie, true story. I'm going to show you a clip. And in this movie, the backstory for those of you who have it is that Antwone Fisher is a young man who was taken away from his mother because she was a drug addict, and he was put in foster care. And sadly, he ended up in an extremely abusive foster care home. And the foster mother, who you will see, had several boys, and she used violence to try to control them. And you'll see, it'll go from, well, let me just finish this sentence. He then gets out of the neighborhood, out of the trouble he's in, and he gets into the Navy. But in the Navy, he starts having unprovoked fights with his shipmates, and that cannot happen. So he's sent to a psychiatrist who's played in this, you'll see, by Denzel Washington. And I would urge those of you who haven't seen the movie to watch it, and those of you who have, watch it again, because it is a wonderful teaching film to teach about not just what trauma looks like, but how people heal and what it takes for people to heal. But we're not going to see all that part because I just want to show you chronic hyperarousal. What you're going to see is a really toxic exposure. And it is offensive and it's disturbing, but it makes the point of where this little boy is at when he then grows up, goes into adolescence, late adolescence, and goes into the Navy. And then it's going to go right into the effect. And now he is in the Navy. He is in the shower room. He gets out of bed, goes to the shower, and is shaving in front of the mirror, and you'll see what happens. Right. Now, our cab driver has a normal response. You got to be kidding. But our guy, perfectly calm, want to go to a hotel room. And when the rescue worker comes up, he said, "Were you in the crash?" No. Because the person that was in the crash is left behind in the crash. This is now another person. He has split. He has had a really fundamental split. And nobody knows it. He goes from here, he rents a car, rents a room, cleans up, goes off, drives off, goes and sees an old girlfriend, has a whole conversation with the girlfriend, still has not let his beloved wife or son know that he's even alive. They assume he's been killed in the crash because they haven't heard from him. The FBI has to come and find him. They do. They take him home. And he's not right. But nobody knows what it is because nobody apparently has learned about dissociation. So he's, trying to get back into his normal life, but his normal life becomes increasingly abnormal. And in this final clip, it's an example of just how abnormal people's behavior under this influence can become. Right. You've all heard about how trauma repeats itself, the repetition compulsion. History repeats itself. This is the way it happens. He is running and running and running in panic because the little boy Byron, whose life he saved, is talking about it. He's talking, people were hanging upside down, we would have been fried. And the more he talks about it, he, by the way, is trauma bonded to our hero here. As he talks about it, our guy is getting closer and closer to all that terror, all that dissociated emotion and experience and visual images. He will do anything not to go there. People will do anything because none of this is, they're not consciously aware of it, but it elicits the threat to survival. And so he runs. He runs, he's in a panic, he's in fight, flight, he's in the flight part. And he's running and running. There's no purpose to his running. But he gets to the street, and it is, after all, a movie, and the light flashes off the thing, the pole, and triggers another dissociation. And then what does he do? Walks into traffic. Risks his life now for no purpose. There is nothing good can come of this. He is very lucky to be alive. He gets across the street and he experiences the exhilaration of surviving a near-death experience that is unattenuated with what is normal, which is fear. Because he no longer has access to fear. That's why the movie's called Fearless. And this whole movie is about repetition, what's called traumatic reenactment. We have thousands, maybe millions of people in this country who are reenacting a previous trauma. And that's how trauma spreads. Because it doesn't just affect him. Now it's affecting everybody in his family. If a guy in the car had hit him, it would have affected the guy in the car. It spreads, just like that virus. That's what violence does. I think, can I have the lights, please? I think at this point, I better stop and lead into a break, and then into our next person, Dr. Anda, who's really going to address this whole issue of childhood adversity as a national health and safety issue.